Welcome back, everyone. We are here today with our second Cabral House Call of the weekend. This is episode 2515. If you want to follow along with today's questions, that would be amazing. You can head on over to stephencabral.com/2515 for all of the questions. So each and every weekend, we go through your questions that have been submitted over the past 12 to 13 or so weeks. Typically, that's how long it takes to get these questions read on the podcast, simply because we have so many people writing in on a daily basis. And of course, as I always say, if you want your question answered the same day, you're trying to find information on your health topic, ask that question right at cabralsupportgroup.com. All right, let's head into our first question today. I'm opening up the big Ask Cabral document, and it's from Brad. And Brad says, have you heard anything about Vedicinals 9 in terms of treating long COVID or prevention altogether? My family and I have had COVID 5 or more times since March of 2020, and even though we try and keep our immune system on the up and up, I'm beginning to wonder if the effects of having COVID are becoming more taxing on my body as time goes by. I've read good reports of Vedicinals 9 and would like to gather your thoughts. Thank you, and I look forward to hearing from you, Brad. All right, so a couple things. One is that we can't use the word treat, so no treating, diagnosing, curing, or preventing disease of any kind. So no medical advice here in the show, but let's talk about natural health. Let's talk about boosting our immune system naturally, right? So 5 or more times, I'm assuming not each individual, because to get COVID 5 times in 2 years or a year and a half would be quite a number. Quite a number. There's not even that many strains. Well, now, sorry, let me step back. Yes, there have been well more than that many strains, but not of that had predominance in the United States or really the world at large. So like they move through letters of the alphabet essentially. And so when you hear about the alpha strain or the beta strain or the delta strain or Omicron or whatever, like you're just moving through different strains, right? Okay. So now keep in mind, same basic virus that's mutated a bit, and it mutates because the virus will preferentially mutate towards the form that's able to take the strongest foothold in its host, right? So that's how a virus works. Basically, it's, essentially DNA, and it activates when it's inside of a host. Okay, so without getting too technical here, have I heard of this product? Yes, I've actually heard of the product. I don't use it in my practice because I look at things more of a foundational based approach. So yes, I love nutritional supplements, but I don't want to just say, take this one thing and you're good. No, I want to make sure people are at least using the foundational protocol, right? So foundational protocol is a daily activated multivitamin or the daily nutritional support, right? Like whatever you want and need. So that's all your B vitamins, because you can't be deficient in B vitamins, vitamin C, vitamin E, like all of your vitamins and minerals, zinc, copper. So this product doesn't have any of those. So you can't use this at the end all be all. Like it's just not going to happen. This is more of an herbal based product, right? Okay. So the next step is this. Once you have those, do you have enough omega-3s or do you have high levels of inflammation? That's going to make COVID way worse, right? Because it's an inflammatory based issue. It's a upper respiratory issue. Okay, so we need to take care of that. And then what about your gut function? Are you using, so daily omega-3 support, daily probiotic support? Are you using those, yes or no? Because if not, you have to use those first. All right. Then what about something like a daily fruit and vegetable blend, so you're getting more of the phytonutrients from nature in you? Okay, so like that's next. And then what about vitamin D? Are you using vitamin D? Because if you're not using vitamin D, that has to come before this, right? And then what about other immune-based factors like vitamin C and zinc and copper, right? So that's our immunity protocol. So we always say to people, all of these things are nice icing on the cake. What we do is daily foundation protocol level 2 or level 3 plus the immunity protocol. That's what I do every day. And then I have something set up called stephencabral.com/the-protocol. stephencabral.com/the-protocol. Now, this is not for the treatment, prevention, diagnose, curing of any disease. There's no medical advice here. This is what I personally do when I get a virus like the one that you spoke about. Okay, this is what I do, and I give you exactly what I do. Now, it has some of those same herbs in there. So the product that you're talking about has curcumin, turmeric. It has quercetin, and I know that it has licorice root. I can't remember all the others. We use all of those. But the products I use are Sinus Support, which has N-acetylcysteine. It has licorice root. It has all those great ones. And then I use Hispro, which has quercetin, vitamin C, etc. So like you're getting the same nutrients because these are proven to work just through different products, right? So I use Sinus Support and Hispro, and you might use this product, but only use it after that you have your foundations met, okay? Good question. Joseph's up next. Hey doc, hope all is well. I'm 48, I'm a very active person. I hit the gym a few days a week and I play hockey a few days a week. I'd like to know whenever I have a pulled or strained muscle, or if I just overdid it at the gym, the pain seems to bother me most of the middle of the night, thanks. Okay, yeah, I totally understand. Like if I push myself with a new workout and you know, I have a little bit more inflammation from that workout, I might actually wake up, not with flu-like symptoms, because I don't want to be dramatic, and I'm being a little bit dramatic, but like my body feels a little bit more tired. My knees and my body, they're not aching like, you know, they're not, it's weird to say, but I can feel the inflammation. I know what you're talking about, so I get it, totally understand it. And again, you're talking about somebody who used to have Addisons disease, and it's much of the same. So what happens is when your body is not able to deal with the rain barrel effect of the inflammation, the muscle tissue breakdown, and it's not repairing it fast enough, that's what you feel. Now, why do you feel that more at night? Well, I relate it to a few things. One, the major repair processes happen at night. So that's one part of it. The second is that your cortisol levels are at their lowest level overnight. And that's not necessarily a bad thing, but cortisol is a natural anti-inflammatory, okay? And so when you're not as revved up and your cortisol is lower, and your natural anti-inflammatory cortisol is not as high, you're gonna feel a little bit more at night. And that's not a bad thing. You don't wanna ramp it up at night, you know, so hopefully that helps. All right, and again, I would look at what I do. Again, I'm not recommending medical advice. I use a product called Cell Boost and Inflammasoothe, and I get great benefit from those. All right, and those again, everything's at stephencabral.com/shop. All of the products that I recommend, all of the labs, but you choose the company that works for you. I just share with you what I do. Michelle's up next. Dear Dr. Cabral, I'm a lactation consultant and registered nurse working in a hospital clinic setting. I encourage breastfeeding as much as I can and consider it the best start for babies when possible. But not every woman makes enough milk, even with all the efforts. Various reasons such as infertility, PCOS, diabetes, obesity can affect milk production. I often have women that don't want to feed formula, but their baby needs supplementation. Is there a formula you would recommend, or do you have any supplement suggestions as to what to look for infant formula? I appreciate any input you have. Thank you. All right, Michelle. Yeah, I've answered this a bunch of times. You can find these answers at stephencabral.com/podcasts. So I always recommend using the search box before you write in. Not that I mind answering it, but honestly, like you get this was written in on September 21st. So that was 3 months ago. So you just get your answer so much sooner. That's all. So I've recommended goat milk formula before, not cow's milk. Okay. And that's what I recommend. Organic whenever possible. I mean, grass-fed pastured. That's why goat is typically better, because there's far less chemicals that go into goat milk. And then the other one that you may want to look into is the Weston Price-based baby formula. Weston Price, dentist that basically got into nutrition, searched all around for indigenous-based people and teeth formation, and wrote a great book on it, right? And nutrition and degenerative-based disease. I don't know the exact title of that. Wow, it's funny. I haven't read that book in many, many years, but the title always used to flow off the tongue, but it's something like nutrition and degeneration-based disease, something like that. But if you type in Weston Price, you will be able to find it. He has a whole foundation. Okay, so that's that. And then also, there are milk banks. I know that they're often called all sorts of different things, but many women will pump extra milk for those women that can't produce enough milk, and that actually may be something to look into as well. But again, at a foundational level, I know it has to happen really quickly. I would always say, like, is there something that we can do to help a woman with her milk production as well? So, but again, I totally understand, and you're doing great work. So thank you, Michelle. Appreciate it. Eve is up next. What is the cause of Granuloma Annulare? How do you get rid of it? Okay, so I don't believe I've ever answered this specific question, but certainly work with Granuloma Annulare quite a bit in my practice. Honestly, it looks a whole lot like ringworm. There is very little difference. Typically does not have the itchiness that the others have, and it's not always segmented to say that it specifically comes from a fungal or candida or yeast-based infection or issue. So the cause of granuloma annulare is considered, basically, this is a raised rash on the skin. Sometimes it looks like little pimples, but no head on it. Sometimes in a circular pattern, which gives it that ringworm-based effect. And conventional medicine, it says it has idiopathic-based backgrounds of where it's formed, or formations, idiopathic formations, which just means unknown. But we do know that it can be caused by food sensitivities, for sure. It can be caused by yeast bacterial overgrowth. It can be caused by toxicity in the body, and much more. So I often see it quite a bit in people with gut-based permeability. I see it with people with yeast and candida-based overgrowth. And so since I'm always running the Big 5 labs or the gut bundle, I'm always looking for what would the underlying root cause be. So again, I think there can be I think the same manifestation can come from different underlying root causes, which is why I always say, if possible, for skin-based issues, there's one main lab to run, and that's the bacteria and parasite stool test. The second one would be the Candida metabolic and vitamins test. The third one would be the food sensitivity test. If possible, you want to run the Big 5 plus the bacteria and parasite stool test. That is best. All right, Gina is up next. And Gina says, "Hi, Dr. Paul. I'm looking for advice regarding fast heart rate that seems to mimic POTS, which is postural orthostatic tachycardia syndrome. It'll go up to 130 plus beats about 10 minutes after eating a meal, especially lunch, and especially going from sitting to standing. Sometimes just by walking outside or going up and down a few stairs. My resting heart rate is in the 60s and overnight goes into the 50s. I've seen a cardiologist, all clear. HTMA showed high calcium, electrolytes under 4. Cortisol hormones test, cortisol, my AM was high, very high actually, double the height that it should be. But the rest of the day, normal cortisol, progesterone is high, estrogen, other hormones normal, ratios all normal. Added magnesium, I've added magnesium, natural Gatorade, multi-C, D, zinc, plan to start adrenal soothe, but worried because of the 3 normal cortisol readings. Wondering what you think I should do next, and if you think adrenal soothe is okay. Thank you so much." Okay. Totally get it. I had postural orthostatic tachycardia syndrome. Same symptoms as you. High heart rate after certain meals. High heart rate going from seated to standing. High heart rate walking up just a few stairs. So I get it. Mine was hypothalamus pituitary adrenal related. What is called dysfunctional autonomia or dysfunctional autonomia. And POTS, they're all one and the same. So essentially what happened was that I had to rewire my sympathetic nervous system and parasympathetic nervous system. So it didn't happen from one thing. I had to fix overall inflammation in my body from my gut permeability, my environmental, my food sensitivities. I had to work on my mind as well, so not get overly stressed all the time. And that just took time. So I healed my gut, the nervous system, the mind, the food sensitivities, I worked on it all. I got rid of heavy metals. I had very high levels of mercury in my body. Mine was mainly from eating tuna every single night in college because I would go to the gym, wanted to work on my body, build up my body. And, I didn't know that mercury had a lot of that tuna had a lot of mercury. So there was that. So there was a lot going on in that aspect, but you have low electrolytes. It says, I don't know, it says electrolytes under 4, so I'm assuming that it means low electrolytes. High calcium, low electrolytes. So I think you have an issue with your stress response as well. Most people with POTS, it's a dysautonomia. So please go to stephencabral.com/podcast. Listen to my podcast on myalgic encephalomyelitis, as well as dysautonomia and POTS. And then also, most likely there's an issue around histamines. And again, the same thing. I had mast cell activation syndrome, mastocytosis. And so when you eat, you're just more sensitive and you produce more histamines and you produce more norepinephrine, and that skyrockets your heart rate. All right. So that is where to get started. Hopefully that was helpful. All right, let's do one more question. Today is from Kayla. Kayla writes in, "Hi, Dr. Paul. I just want to start off by saying thank you for all you do. Your podcasts give me hope every day." Thank you, Kayla. I appreciate that. And that's what they're meant to do, right? Give hope. And because the truth is that everybody can heal. It doesn't mean it's going to happen overnight. And usually it shouldn't, because you want to learn the lessons that get you well so you take them then for the rest of your life. So that's why I'm not upset that I had to get well from 17 years old to 27, right? Because at 27, then I got it. but then I really got it at 28, 29, 30, and kept going. Now I really get it this year. And next year I'm going to get it even more. And so I'm just kind of taking it to that next level. So I just want to share that with you. All right, Kayla says, I've done 2 labs, a starter kit, and I've been working with one of your IHP coaches. She's great. I've done the 7-day detox and I'm now on the parasite protocol. It's my 2nd week. Here's my question. I suffer from psoriasis and have occasional couple times a day anal itching and fissures. Doctor keeps telling me it's related to psoriasis, the itching, and the fissures due to constipation, which I am not. I can't shake off my negative thoughts that it's something worse. And every time I look down there, I can't see anything but some fissures and a bit of swelling. Is this related to candida and parasites? My candida levels on my lab results weren't that high. Okay, yeah, and I can answer this as well. So again, of course, I'm not giving you a diagnosis right here on the podcast. That's not how things work. But no, I mean, anal itching and anal fissure and fissures in general, that's just not constipation. So don't let your doctor say there's only one cause of that. Anal fissures can become from any inflammation, like literally any inflammation. And the most common inflammation with the digestive tract is parasites, candida overgrowth, bacterial overgrowth, just because those cause inflammatory-based issues, an imbalance based on the bacteria, and food sensitivities. So for the most part, I see a lot of anal itching with parasites, candida overgrowth, and food sensitivities, okay? So those are the main 3. Fissures, I see it even more so with parasites and food sensitivities. So again, here's the interesting thing. You can run an IgG food sensitivity test. You haven't done that yet, and it's great to do. So no doubt about it, it's great to do because when you eat those foods, you're going to have inflammation. There's no doubt about it. Like that's clinically proven, okay? So the other thing is this though. Some things you will be sensitive to that when you do a food sensitivity test, they will not show up because a food sensitivity test is testing the proteins, right? But let's take, for example, me. I don't do well with a lot of nightshades. If I eat some heirloom tomatoes, which I love when I'm out at a restaurant, no problem. If I were to eat them every day with like potatoes with the skins on and eggplant and those types of things, no, I would get I would be flared up with inflammation like around my joints. I don't do well with nightshades. I just don't. But those don't show up as a food sensitivity. So what I want you to do, Kayla, is this is how we help people in our practice. I want you to listen to my podcast on the rotation diet. And if you can't find it, just ask at cabralsupportgroup.com. We're here to help. Literally, we have a team that's dedicated to helping you get your questions answered at cabralsupportgroup.com, even if you're not, a private client. So that's it. I want you to do the rotation diet, and I want you to find out what makes it worse, what makes it better. Over the course of 3 to 6 weeks, you're going to be able to figure this out. What foods make it worse? What foods are better for you? And again, move through the Parasupport protocol and then keep a basic diet and then figure out what's moving it, what's making it worse. And again, you're going to figure this out. There's no doubt about it. This is how we do it. It's just, if you're willing to stick with it, you will figure this out just through, as they say, trial and error, but it's educated. It's educated trial and error. It's not just like, oh, I'm going to try this. No, it's a specific plan and it's free for everybody. You can find it at stephencabral.com/podcast. Type in rotation diet. And if you can't find it, then the amazing Michelle or Daniel will be able to get that for you. All right. Thanks, everybody. I hope that this was helpful. If it was, of course, feel free to share this information with anyone you believe it could serve. And I'll be back tomorrow with a brand new Mindset and Motivation Monday. I'll see you then.